Now, the recent women's report by Stellenbosch Business School and the SA Board for People Practices says women spend 25% more of their working lives dealing with health challenges than men do. But targeted support by employers for women's health needs can improve their productivity and quality of life. That's according to this report. Women make up 51% of the South African population. However, despite a steady increase in women in the labour force, men still have a higher employment rate, and women's unemployment at 35.2% remained higher than that of men at 31% in the first quarter of 2024. To take this discussion further, we're joined now by video link by Prof Anita Bosch, who's the Research Chair in Women at Work at Stellenbosch Business School. A very good evening to you, Professor. Thank you so much for your time. I mean, women spending 25% more of their working lives dealing with health challenges than men do, yet they still have to deal with the issue of inequality in the workplace. What information came out of your research as you found these, this insight and compared men and women in the workplace?
So I think this is important to note that this particular information and the statistics were done by McKinsey. Mm-hmm. What we did in the Women's Report is it is, as always, and it's the 14th year of the Women's Report, we bring evidence-based information to the public. And in the Women's Report, we report on women's illnesses and the unspoken illnesses that usually are ignored in the workplace, but that we know influences productivity and the ability to really bring your full gifts to the workplace.
What are some of the illnesses that really came out at the forefront as this information was gathered?
Yeah, so aspects like endometriosis, the menopausal condition, those are things that are never spoken about in workplaces. Women's reproductive health is seen just as a sort of a matter of normal course, but there are many complications that can step in that are often not looked at. More specifically, really, is the fact that in terms of research and medical research, women's diseases are very low on the list of research priorities. And yet what we do know is that women's bodies function quite differently from men's, and therefore some of the treatment that gets prescribed to them is not effective for our body types.
With that information, what role should the employer play in this regard? Because in essence, what you're saying, that targeting women's health can boost the economy. And so far, even as you and I speak, it's not doing so well.
Yes, the economy is not doing well for various other reasons. Yeah. One of the aspects that can help boost is to employ everybody that is ready and skilled to do work, and that means job creation, and that's a very big, or should be a very big target for our new government of national unity. Mm-hmm. The reality is that when women also contribute to the economy, GDP increases, and more specifically, it has a massive impact on the household level, where in our country, the majority of households are headed by women. And so it can make a marked difference in terms of our future generations and the talent development there, when households actually have people that are employed and therefore can create new futures for our next generation.
So when it comes to the employer, what sort of factors should be considered now as we look at women's health and the impact on delivery and production within the workforce?
From the employer side, I think what's really important is education, and that's what the Women's Report aims to do. So it's available at womensreport.africa. And more specifically, that would be to educate, especially male managers, on what women undergo, but also not to treat it as a pathology, but rather to say, well, okay, you know, if these symptoms, for instance, of menopause exist, exist. How can we destigmatize these aspects? There's also the policy related work that needs to be done in workplaces, and certainly their flexibility does help a lot when dealing with these issues. There's the other issue that a lot of women take sick leave in order to deal with their children, so it distorts employer figures when they're thinking about the number of people that are sick every year. And just in terms of that, having discussions around that, when can you take sick leave, what is it for, and when should family responsibility leave kick in, and how can employers be a little bit more flexible around those realities, because it is, after all, both men and women that make for the new generation, and families that need to be supported, not only women.
Yeah, absolutely. And very lastly, before we let you go, you speak about education being the main driver here, educating employers, more so male employers. But isn't it perhaps male and female employers that would need this kind of education? Because it doesn't necessarily mean that if you're going to speak about menopause to a female, another woman in the workplace, that you could possibly get some sympathy, because, I mean, one would say business is business.
Yes, and business is absolutely business, but we must remember that we construct the workplaces that we work in. Workplaces don't exist in of themselves. They're not like, natural phenomena. And so therefore we can shape it. And so absolutely, to that point, whoever's interested in having committed and energized employees in their workplace should really pay attention to what it means to be a human, which includes the health issues that come with being human.
Yeah. Very well. Thank you so much for speaking to us, Professor Anita Bosch, who's the Research Chair in Women at Work at Stellenbosch Business School. She is also the editor of the annual Women's Report by Stellenbosch Business School and distributed by the SA Board for People Practices. Very important information coming out of that report.